Dear students, welcome back. In the previous session, we have discussed about the modifications of the deep fascia and its attachments, isn't it? Yes, in that we have discussed about saphenous opening and intermuscular septa. Now, in this session, we are going to discuss about the iliotibial tract. This iliotibial tract is also the modification of deep fascia of the thigh. Okay, so the iliotibial tract is formed by the fascia, that is deep fascia or fascia lata, is thickened laterally. So here you can find the fascia is thickened laterally, where it forms 5 meters wide band called as iliotibial tract. Okay, so here you can find, so this is 5 centimeters wide band called as iliotibial tract. So here on this side you can see the lateral aspect very clearly in this picture. So the fascia lata is thickened laterally, where it forms 5 centimeters wide band called iliotibial tract. Now we will see the attachments of the iliotibial tract. So superiorly, this tract is splits into 2 layers. So superiorly, it splits into 2 layers. One is called as superficial lamina and another one is deep lamina. So superficial lamina is attached to the tubercle of the iliac crest. So here you can find tubercle of the iliac crest. This is the superficial lamina which is attached to the tubercle of the iliac crest. And the deep lamina which is attached to the capsule of the hip joint. Okay, so the deep lamina is attached to the capsule of the hip joint. And if you see at the inferior aspect, inferiorly it is attached to the smooth area on the anterior surface of the lateral condyle of tibia. Okay, so this iliotibial tract is attached to a smooth area on the anterior surface of the lateral condyle of tibia. Okay, so this is the modification of a deep fascia which is thickened laterally, where it forms 5 centimeters wide band called iliotibial tract, and superiorly it splits into 2 layers. One is superficial lamina and deep lamina. Superficial lamina attached to the tubercle of the iliac crest, whereas the deep lamina attached to the capsule of the hip joint. Inferiorly, it is attached to a smooth area on the anterior surface of the lateral condyle of the tibia. So now we will see what is the importance of this iliotibial tract. So two important muscles are inserted in its upper part between superficial lamina and the deep lamina. So these muscles are gluteus maximus muscle and tensor fascia lata muscle. Okay, so don't confuse with this tensor fascia latae muscle with that of fascia lata. Okay, yes. Okay, so this tensor fascia latae is a muscle. Fascia lata is a deep fascia. Okay, yes. So this iliotibial tract, in its uppermost part, it gives insertion to two muscles. One is gluteus maximus muscle, another one is tensor fascia latae muscle. So 3/4 part of the gluteus maximus, 3/4 of the gluteus maximus is going to insert in the iliotibial tract. Okay, and also this tensor fasciolata is inserted into the iliotibial tract. And at the lower attachment, that is the inferior attachment of the iliotibial tract, has an important function here. Is the iliotibial tract stabilizes the knee both in extension and in partial flexion. So this iliotibial tract is going to stabilize the knee both in extension and in partial flexion, and is therefore used constantly during walking and running. In leaning forwards with slightly flexed knees, the tract is the main support of the knee against gravity. So this is about the iliotibial tract. Okay, if you see the clinical anatomy as a whole of the fasciolata, which is attached to the inguinal ligament, and extension of the thigh pulls the abdominal wall downwards and makes it tense. To relax the abdomen fully for palpation by an examining physician, the patient is asked to draw the legs up. This overcomes the pull of the fasciolata on the abdominal wall. So this clinical anatomy is related to entire deep fascia. So this is all about the iliotibial tract. In the next session we are going to discuss about the femoral triangle. Thank you.